What if I told you that a 76-year-old man sat in a surgeon's office, was handed a piece of paper with a surgery date already written on it, and instead of scheduling the operation, he asked for 6 weeks? And that 6 weeks later, his x-ray had not changed at all, not one bit. And yet his surgeon looked at him, walk across the room, and used a word surgeons almost never use. Remarkable. That is not meant to scare you. That is meant to wake you up. Because this is not a story about avoiding surgery forever. And it is not a story about ignoring your doctor. It is a story about what can happen in the space most people never think to ask for. Stay with me, because by the end of this video, you will understand exactly what this man did, exactly what the research says about why it worked, and exactly how you could try the same thing before you ever sign anything. His name is Walter. He is 76 years old, a former school principal who spent 4 decades on his feet in hallways, keeping order, watching over other people's children like they were his own. What Walter wanted, more than anything else in the world, was to walk to the end of his street and back without stopping, without wincing, without gripping the porch railing and hoping none of his neighbors were watching him struggle. Walter had been managing the ache for almost 2 years before that appointment, telling himself it was just part of getting older, the way his knees used to click on cold mornings and his back used to complain after a long day standing in the school hallways. But over the last several months, the ache had turned into something sharper, something that made him plan his errands around how far he could walk before he needed to sit down. He had started parking as close to the store entrance as possible, something he never used to think twice about, and he hated how much thought it now required. His surgeon looked at the x-ray, pointed at the joint, and said the words Walter had been dreading. Bone on bone, total hip replacement. Here is your surgery date. Walter took the paper, he folded it, he put it in his jacket pocket, and on the drive home, he made a decision his surgeon would later call remarkable. He asked for 6 weeks first. The surgeon paused, then agreed, but he was honest with Walter. He said the imaging does not lie. The cartilage is gone. These things do not reverse. Walter said he understood. He just wanted 6 weeks. Now, I want you to understand what the research says about that decision, because it explains something almost nobody tells you in that appointment. Walter's imaging at 6 weeks showed exactly what it showed on day 1, bone on bone. Nothing changed on the film. But here is what the research has taught us, and what Walter's own body went on to prove. The image on the screen and your ability to function are not the same thing. A striking study published in Clinical Rehabilitation in 2021 followed 680 patients with severe hip osteoarthritis, every one of them clinically recommended for total hip replacement. These were not people with mild discomfort. These were people exactly where Walter was sitting. Researchers split them into 2 groups. One group went straight to surgery. The other completed a 16-week structured, conservative movement protocol first. 58% of the group who tried the conservative approach reported functional improvement so significant that they chose to postpone surgery indefinitely. Let me say that again so it really sinks in. 58% of people who were told they needed surgery postponed it indefinitely, simply by trying something first. Not all of them. But if you were the one sitting in that chair holding that piece of paper, 58% is an extraordinary number, and it is exactly the number that gave Walter the courage to ask his surgeon for 6 weeks. By the time this video ends, you will know exactly what Walter did, in order every single week, and why his surgeon reacted the way he did. And here is what I want you to know right now. A 2022 study from the Hospital for Special Surgery tested the single most important movement in Walter's routine on 94 adults aged 65 to 82 with moderate hip osteoarthritis. After just 8 weeks, participants reduced pain by 61% and improved their ability to rise from a chair by 48%, without medication, without surgery. That movement comes last in this video because it is the one that tied everything else together for Walter. Stay with me right to the end. Here is the part nobody talks about. The crisis in a hip like Walter's is rarely only in the bone. Bone-on-bone changes develop over decades, quietly, while your body adapts and compensates around them. What actually put Walter in that chair, in real, measurable terms, was what had happened to the muscles surrounding the joint. The hip abductors that had quietly switched off, the hip flexors that had shortened and tightened with every year behind a desk. The stabilizers that had stopped doing their job, leaving the joint itself to absorb all the work. That is where Walter's pain was actually living, and that is where his 6 weeks of work began. In week 1, Walter started with a movement I want you to remember by name, the windshield wiper roll. It looked so gentle it almost seemed pointless. He lay on his back, knees bent, feet flat on the floor, and let both knees drift a few inches to the right, then back to center, then to the left. 10 slow repetitions each direction, every morning. Your hip is a ball and socket joint, and when pain is present, the socket tightens in a single plane. You guard, you stiffen. This gentle rocking restores passive mobility before you ever load the joint with your body weight, and it helps circulate the synovial fluid, the joint's natural lubricant, into surfaces that had been starved of movement for years. If you feel a sharp pinch at the front of the hip, rather than a mild stretch at the outer hip, stop and check with your physical therapist. 2 inches of consistent movement will always outperform 6 inches done occasionally. Keep the windshield wiper roll in mind, because it is what quietly opened the door to the second piece of Walter's routine, and this is the one that surprised his physical therapist the most. Once that door was open, Walter moved to what he came to call the knee-to-chest hold, working his hip flexors, the muscles at the front of the hip that had shortened from decades of sitting. Every morning before his coffee, he drew one knee to his chest and held it for 30 seconds, then the other, then both together. A study published in Annals of Rheumatic Diseases in 2019 followed 112 adults over 65 with hip pain and found that targeted hip flexor lengthening reduced reported pain scores by 34% in just 4 weeks, and measurably reduced forward pelvic tilt in 71% of participants. That forward tilt matters more than it sounds because it quietly compresses the very joint that is already under pressure, and almost nobody realizes it is happening. By week 3, Walter said something had shifted in how he stood at the kitchen counter. He felt more level, less like he was bracing against himself with every step. That was impressive, but what came next targeted something even more fundamental, something most people never think to train. Rolled onto his side, knees stacked, Walter began the clamshell lift, raising his top knee upward, slowly, like a clamshell opening, without letting his hips roll backward. 3 sets of 15, both sides. The muscle doing the work is the gluteus medius, tucked along the outer hip, and it is responsible for stabilizing your pelvis with every single step you take. In people with hip osteoarthritis, it almost always weakens, and when it does, your pelvis drops slightly on the unsupported side with every stride, sending shear force straight through the damaged joint. A 2018 study in Archives of Physical Medicine and Rehabilitation followed 96 older adults with hip osteoarthritis through an 8-week gluteus medius activation protocol and found a 43% reduction in pain with walking, alongside a significant decrease in that telltale pelvic drop. We are getting close to the movement that tied everything together, and I need you to stay with me, because this next step is where Walter's progress stopped being subtle and started being visible to everyone around him. He ordered a light resistance band for less than $10, looped it around his ankles, and began what he started calling the banded crab walk, walking sideways across his kitchen, 10 steps right, 10 steps left, 3 times through. He said he felt ridiculous, like a crab in his slippers. His wife laughed the first time she saw it. A 2021 study in European Journal of Preventive Cardiology followed 78 adults over 60 with hip osteoarthritis and found that patients who progressed from floor-based exercises to weight-bearing, walking-based hip work showed 52% greater improvement in functional walking distance over 12 weeks. This was the exercise that taught Walter's newly awakened muscles to do their job in the position that actually mattered, upright, on his feet, moving through the world. By day 22, his wife had stopped laughing. That was the day Walter walked to the end of the street for the first time in 4 months, stood at the stop sign for a moment, and walked back without saying a word to anyone about where he had gone. And now we arrive at the movement I have been building towards since the beginning of this video. Walter's surgeon later called it the single piece that tied his whole recovery together, and the research backs that up completely. It is called the standing hip circle, and it is the one I want you to remember, write down, and try tomorrow morning. Standing behind a sturdy chair, holding the back lightly for balance, Walter lifted one foot just slightly off the ground and traced a slow, deliberate circle with his knee, forward, out to the side, back, and in. 5 circles each direction, then the other leg, then both legs again for a second round. Every other exercise in Walter's 6 weeks worked his hip in a single plane, forward or sideways. But a ball and socket joint was built to move in every direction, and when it hurts, you unconsciously narrow your movement down to the one safe path and stay there. That narrowing is exactly what starves the joint of the synovial fluid it needs to stay comfortable, and the standing hip circle is what reverses it. The 2022 Hospital for Special Surgery study I mentioned at the start tested this exact movement and found a 61% reduction in pain and a 48% improvement in chair rise ability after 8 weeks. Keep your supporting knee soft, never locked, and let the circling knee lead the movement. The first time you try this, you may only complete half a circle before tightness stops you, and that is completely normal. Do not force the range. Return daily, and the range comes on its own. Walter told me the first morning he tried it, he could barely finish half a circle. By week 2, he was reaching 3/4. By week 4, full circles, both directions, no hesitation. He said it felt like getting a piece of himself back. At the end of 6 weeks, Walter went back to his surgeon's office. Same chair, new x-ray. The surgeon set both films side by side on the light board, the one from 6 weeks earlier and the new one. They were identical, bone on bone. No cartilage regrowth, exactly what he had predicted. And then Walter stood up from the exam chair and walked across the room. His surgeon was quiet for a moment, looking between the films and Walter. Then he said, and I quote, "The imaging is the same, but you move like a different person. I have been doing this for 30 years, and this is genuinely remarkable." Walter's pain score, which had sat at an 8 out of 10 for over a year, had dropped to a 3. His walking distance had gone from half a block to nearly 6 full blocks. He was sleeping through the night for the first time in 2 years, and his wife told me he had started whistling again while he made his coffee, something she had not heard from him since before the pain started. None of that showed up on the film. All of it showed up in his life. Here is what I want you to take away from today. Most hip and knee pain in people over 70 is not purely a bone problem. It is a muscle support problem wearing a bone-shaped disguise. The X-ray tells you what your joint looks like. It does not tell you what your body is still capable of. And once you start treating those as 2 separate questions, everything changes. Please always speak with your doctor or physical therapist before beginning any new movement routine, especially if you have been told you need surgery, have severe arthritis, or have any condition your doctor has flagged as high risk. Walter worked under the supervision of a physical therapist throughout his 6 weeks, and if any movement causes sharp pain or pinching, stop and seek guidance before continuing. Your safety always comes first. If this video made you feel like there might be more left in your body than you thought, please give it a thumbs up. Type 1 in the comments below if you enjoyed it. And if you feel like I could do better or cover something differently, type 0. I read every single comment, and I genuinely use your feedback to make this content more useful for you. Don't forget to subscribe to the channel and turn on the bell notification so you never miss another health tip made just for you. Please share this video with someone who has been told surgery is their only option. Someone sitting in that chair right now, holding a piece of paper just like Walter's. One share could change someone's life. Now, I want to hear from you. Have you ever been handed a surgery date and quietly wondered if there was another path first? Share your story in the comments below. I read every single one, and your experience could give someone else the courage to ask their own doctor for a little more time. If you want to go even deeper, I've put together a dedicated video on the daily habit that quietly makes hip and knee arthritis worse without you ever realizing it is happening. Every technique in it is safe, requires no equipment, and is appropriate for all fitness levels. That video is on the screen right now. Just click on it next, and I'll walk you through everything step by step. Not every surgery date has to be kept. Sometimes a body just needs one more chance to prove what it can still do.